Mr. Crow, good afternoon. My name is Matt Durian, and I'll be your student nurse today. Can you please provide me with your full name, your date of birth, and your MRN? While I do that, I'm going to wash my hands with soap and water and don gloves. Mr. Crow, do you have any allergies to food, medications, to the environment, to latex or tape? Okay, information here matches the information provided in your chart. Mr. Crow, your vital signs here. Your blood pressure is 120/80, which is normal. Your respiratory rate is about 15 breaths per minute. Your heart rate is about 70 beats per minute. Your oxygen saturation is about 98%. And your temperature is 98 degrees Fahrenheit. Mr. Crow, can you please tell me a little bit more about the pain that you're experiencing in your back? Can you tell me about the onset? Where exactly did the pain start? Can you tell me about the location of the pain? Can you tell me about how long that pain has lasted for? Is this a sharp pain? Can you please characterize the pain? Is it sharp or is it dull and achy? Can you tell me about what makes it worse and what makes it better? Have you also tried any treatments? Can you please also rate your pain on a scale from 1 to 10? From 1 being no pain at all to 10 being the worst pain imaginable. The patient exhibits no signs of distress and is oriented to person, time, and place. Also, if the patient had any tubing for oxygenation or for IV lines, I would make sure that, or catheter, I would make sure that I assessed that and to make sure that there were no kinks in there or it presented no hazards, fall hazards for the patient. Mr. Crow, I'm going to take a look at your hair, skin, and nails. I'm going to start with your head. I'm going to take a look at your scalp, okay? Okay, scalp appears to be normal cephalic. There's no hair loss. Mr. Crow, I'm going to take a look at your ears. Okay, ears are bilaterally functional, appears. Take my otoscope. Look inside, pearly gray. Okay, Mr. Crow, I'm going to take a look at your eyes. Conjunctiva looks pink. No drainage. Ptosis, no ptosis. Sclera looks white. Eyebrows seem symmetrical. Mr. Crow, can you please take a look at my pen light and follow my light? Okay. Pupils are round, reactive to light. Mr. Crow, please look at my finger and look at the apple on the wall back here. Okay, very good. Pupils are reactive to accommodation. Take a look at your nose, Mr. Crow. Okay, nares appear to be functional. There's no drainage. Mr. Crow, can you smile for me, please? Okay, very good. Smiling is symmetrical. Can you open your mouth and say ah? Okay, uvula is present. Tonsils are present. No inflammation. Mr. Crow, I'm going to take a look at your the rest of your body here. I'm going to take a look at your skin, okay? Okay, no edema. I'm going to check your capillary refill, Mr. Crow. Okay, cap refill is less than 3 seconds. Okay, take a look at your nails. Okay. Skin turgor is normal. Mr. Crow, I'm going to take a look at your respiratory system. Your diaphragm and your intercostal muscles appear to be functional, and your breathing rate at 15 breaths per minute and your heart rate at 70 beats per minute are normal. But I'm going to take a look. I'm going to move you over here so that you're more comfortable, okay? Turn you this way. Examination. I'm going to put this on. Okay, I would do this assessment on the skin, using the diaphragm, and I would utilize a Greek key pattern. Okay, Mr. Crow, I'm going to have you take a deep breath in and exhale, please. Okay, deep breath in, exhale. Deep breath in, exhale. Deep breath in, exhale. Deep breath in, exhale. Okay, very good. Okay. If also present, I would educate the patient on how to use an incentive spirometer. Mr. Crow, is there anything else that I can do for you today? Okay. I'll be right back. I'm going to go document my findings.